Okay, so I want to welcome everyone to the Office of Practice and Research, our Grand Round Seminar, which is it would be a diet seminar today. We are truly grateful to have with us Dr. Joanne Chopak-Foss, who is associate professor in our department, and then Miss Alisha Riggins, who is a DRPA student in our department. They will be speaking to us today about a couple of things centering both on maternal and child health, as well as the successful partnership they have had as mentor and mentee. And hopefully, you will be here for the whole seminar. And I know if you do stay, you will learn a lot from these two wonderful persons. So without further ado, I will turn it over to whoever of the pair wants to speak first.
Well, I think we both want to say thank you. Thank you, everyone, for being here. It's so exciting to see so many of our students, and shout out to a former student who joined us, Bradley Neighbors. So great that you were able to get this information. Wow, I'm touched. Yeah, so we're going to go ahead and get started, and we'll start with okay. So the first thing that we thought about talking about in this talk was really what the meaning of a mentor is, and that it can have many different meanings depending on the context or setting. So a mentor in the most elementary sense isn't someone who is considered an experienced or trusted advisor. I think about it as someone that I or other people can learn from. The who is a mentor really depends on the context. And in the academic setting, we talk about a mentor usually with respect to a professor from a course. In this case, Alisha, I have the privilege of having Alisha as my graduate assistant, and we'll talk a little bit more about that in a minute. And or another faculty who has common research interests, if that's what your interests are. A mentor can be someone, if you're interested in doing more teaching, you might have a mentor who has more of a teaching load in which you could learn about putting together a course and pedagogy, curriculum, etc. And you know what? A mentor can also be another student, someone who is further along in the degree program in which you're in, but who may have work experience in one of your areas of interest. Most importantly is that students can have several mentors. And here in the college, we really encourage students to have multiple mentors. It does not have to only be limited to the person to whom you might be assigned as a GA, or to just one person from a course, because different mentors fill different roles for depending on what the needs are. And so what do mentors do? They share tips and tricks for being successful in the degree program. They certainly can serve as a springboard for advice on career goals, and also providing opportunities and resources for student success.
So I wanted to talk a little bit about how we began our mentee mentorship partnership. So while completing my Master's of Public Health and Community Health here at Georgia Southern, between 2019 to 2021, I decided to take the Foundations of Maternal and Child Health class that Dr. Chopak-Foss was teaching that year, because it really aligned with my interests. And so later on, after I graduated, worked in the field, and had decided to come back to Georgia Southern and the College of Public Health for the DRPH, I reached out to her asking if she would be willing to write a recommendation letter for me for the application. And then once I was accepted, Dr. Chopak-Foss reached out to me to ask if I was interested in being her graduate assistant starting in fall of 2022. So I was really excited for that. We both have a mutual interest in maternal and child health. This shared interests really set a strong foundation for our partnership. It helps us collaborate on various projects that align with our common goals and interests. So I think it's a little bit easier to work on something when you're really passionate about it. And that has worked out really well in our favor. And it really provides a great sense of direction, and kind of what strengthens our partnership is that shared interest that we both have. And so I'm really grateful to have had the opportunity to be a GA and a mentee with someone who has shared interest in research and the area that I'm very interested in.
So a little bit about growing the mentee mentorship partnership. I take as a mentor what I refer to as a very collaborative approach. Alisha brings a set of complementary skills to our partnership, to our working relationship. Her creativity, for example, in creating promotional material to publicize different events that we'll talk about with respect to the Maternal and Child Health Interest Group, really has enhanced our work and made really just being able to advertise and just encourage more students to participate. But collaboration really requires, I believe, the mentor to be willing to teach, or I look at it as a guide, more of a guide on the side. I don't think it's necessary. I think it's important, excuse me. I think it's important for students to have the opportunity to figure things out. So my approach is a little bit more, it's somewhat hands-off, but it's also hands-on at the same time. And Alisha will touch on that with respect to communication. I do take the role of mentor seriously in that I work to expose the student, whomever I have as whoever wants to be mentored, to a variety of opportunities to enhance their experience, and in her case, enhance her experience as a doctoral student. In the last year, I had the opportunity to also serve as a applied practice experience supervisor to another student, and I believe that really more formulated into a mentor-mentee relationship, in that we talked not just about the things that she was doing to complete successfully her practicum, but also goals for the future, and with respect to public health and where the students saw themselves within public health.
Yeah, so communication methods, effective communication is a crucial aspect of our mentee-mentorship partnership. We hold regular meetings in person, through email, Google Chat, to discuss the progress of our projects and brainstorm new ideas for what we want to accomplish each semester. And so that really helps us stay up to date with the development of our projects. And being here in person, Monday through Thursday is, that face-to-face interaction. You can't beat that. It's so helpful to, go down the hallway to, ask a question, or so, she's been really great about having such strong communication with me, and again, sharing those ideas and feedback that we have for each other. So again, communication really is very important in our mentee-mentor partnership.
As is the division of tasks and responsibility. I work really hard not to be a helicopter mentor, meaning similar to my role as a helicopter parent. I think that it's important to provide clarity of direction. But the good news is that Alisha, for me at least, is a self-starter. She doesn't need to have me hovering over her. And I'll just share quickly that we really have learned to sort of think along the same lines. And a couple of things I was thinking about, and I said, I was thinking about this for the group or this for the group. And she said, well, I kind of already started it. So to me, that's the ideal mentee for me, is someone who starts to anticipate, in a sense, of what I could be thinking or what I'm might be wanting, but and also feeling comfortable to say, well, I'm, because she was going to just tell me and about her ideas, and again, we were on the same page. So sometimes I will need Alisha to drop what she's doing because a hard deadline has come up and I really could use her help. And I very much appreciate being able to do that. You might have noticed her a year ago camping out in the lobby of Hendrix, and I have very fortunately secured her some space so that hopefully we'll have it as an office for maternal and child health in the next year, fingers crossed. But she's now a little bit closer down the hall, and I do have an open door policy. And she can come in and talk to me at any time that she needs to, or as she said, we message each other just to make sure we're, if we're here or in the middle of meeting with someone else.
Yeah, and that flexibility and adaptability are again so important in our working relationship. Again, navigating project deadlines, balancing our personal responsibilities. My schedule is all over the place sometimes, and so again, it's important to prioritize our tasks that we have, and again, being able to drop whatever I'm working on to switch to something else that has higher priority. So
a little bit more in depth about how I've asked Alisha, or how we've collaborated. The first and foremost, in the doctoral program, at least, we really are trying to expose our students to a variety of experiences, because we don't know if they're going to choose to go into the public health practice workforce, or they're going to choose an academic position. So Alisha does not need to accompany me to class, although she did come last fall to the Foundations of Maternal and Child Health class, and last year to the capstone course in the spring. But one of the things I value is that, having taken the course before, I wanted her input with respect to the content of the course, as well as the assignments and topics. And so I very much appreciate that she provided honest feedback. I asked her, about if she thought it was too much, too little. Was I explaining it? I asked her to read what I said. Were the instructions clear? And I'll do the same again next fall when the class comes around. With respect to impact on maternal and child health outcomes in Georgia to date, we had our first face-to-face presentation at last year's GPHA conference in Jekyll, and that's the title of what our talk was about. And we had great attendance and really good feedback. We also did two poster presentations at the American Public Health Association meeting this past fall, and our goal this year is to submit an abstract to the European Public Health Association meeting that will be held in October. We've also co-authored publications. We'll see some that are related to maternal and child health interest in a minute, but just by ourselves, we have two in preparation with other co-authors. Another opportunity that I have been able to include Alisha along with our other student last summer was to attend the Mercer Maternal Health Symposium in Macon. And we attended, of course, as participants, but just to have an opportunity to network with other folks in the maternal and child health space. And also, because I'm on the planning committee for our Magnolia Coastlands plus JPH, COPH Maternal Health Symposium, Alisha has been part of that. And we just have some pictures to share with you of those opportunities. The picture on the left includes Alex Alford, who just finished her MPH and who was a very integral part of our team. And these are some of our other students, and some of you may already be on the call. So that was from the AHEC, the Maternal Health Symposium last spring. And this is our APHA and then our talk at GPHA last year. The one thing before Alisha came, I told her, and again, it was really her essay that led me to ask her, because of course her question was, what opportunities are there for graduate assistantships? And it just worked out that I did not have a GA. And I said, well, as a matter of fact, would you be interested? But here's what I'm, hoping to have someone who is interested in taking a leadership role with the Maternal and Child Health Interest Group. And some of you are on the call or are members or have been attending our activities, and we're really excited to have you. So the Maternal and Child Health Interest Group was founded in 2019 for students and faculty to have a space to discuss MCH-related topics and issues, participate in research activities, and get involved with community engagement and education and service related to maternal and child health. This was it was founded in 2019 with my other GA at that time. And what we started to hear were just students were really asking other faculty if there was a class, if what opportunities there were. Maternal and child health issues, particularly in Georgia, are really taking center stage. So it was really time for us to look at how we could expand this for our college. And there's some available grant money that we hope to go after in the next year to really establish our maternal and child health footing here in the college. But the group is open to any Georgia Southern undergraduate. Right now, we have mostly participation from students in our college, but as you can see, the visual on the right, maternal and child health issues are interdisciplinary and multidisciplinary, and they cross over both not just public health and nursing and sociology and psychology, social services, violence prevention, substance use. I mean, every topic sort of can weave into different aspects of both maternal and child health, infant and child health. And so my vision, along with the student at that time, was really to foster an integrated approach to looking at maternal and child health issues with who we had in the college. So we've really tried to, and that also should say undergraduate or graduate student, but faculty as well. And we're very excited that we have had some faculty participation in different research projects, but the idea is to look at maternal and child health issues from all aspects of public health. So from the community health perspective, of course, looking at programs, as well as services, from the health policy, looking at policies related to maternal and child health. But MCH epidemiology is a huge, huge field because all of these topics have numbers and data to support what we're saying is either a disparity or just a large number of people being impacted by a particular issue. The other thing about maternal and child health, as I said, in terms of integrated or multidisciplinary, is that it is an umbrella term, but has so many subtopics related to it. And some of the ones we've included, some of the ones that we've been working on, perinatal mental health, or what's referred to as perinatal mood and anxiety disorders, or PMADs. Certainly looking at improving maternal mortality. Georgia has one of the highest maternal mortality rates, and there's huge disparities in who is most impacted by these, by that. Improving infant feeding practices, especially in rural areas and among low-income women, is a priority to encourage more breastfeeding and longer duration and exclusivity, and of course, reproductive health care and reproductive health care access. On the other side of infant and child, reducing infant mortality, and of course, access to healthcare for adolescents, chronic diseases in childhood, adverse childhood experiences, just to name a few. And also under the umbrella is women's health issues, or predominantly those that really affect reproductive health, whether it's infertility or reproductive cancers that impact those health organs, et cetera.
So like Dr. Chopak-Foss mentioned, fall 2022 marked the beginning of my collaboration with her as I became her graduate assistant. And as her GA, I lead the maternal and child health interest group. In this role, my responsibilities involve coordinating monthly meetings, facilitating discussions, inviting guest speakers, recruiting general members, selecting co-chairs for research and outreach, and assisting with research projects and outreach coordination. And so it's been a really rewarding experience, and think I've grown as a leader by being in this position. And then with the guidance of Dr. Chopak-Foss, I helped develop and manage both the MCHIG Google site and newsletter. She mentioned that a little bit earlier on the presentation. She's really great about letting me have creative freedom over some of these projects that we've started. So I've been very thankful. Working, independently, but very responsive to any feedback that she may have for me. And so again, I kind of have this sense of ownership of some of the products that we've, developed or I've helped with. And so that's something, it's, it's always nice being a valued member of, any kind of team or any kind of partnership. So I've always been very thankful. Additionally, we were able to obtain a MCHIG email. And so that's been really instrumental with keeping in touch with all of our MCHIG members. And so, that's been a great tool to have. And then an example of one of the first things that I had to do was actually develop a flyer for the Belly of the Beast panel screening. And so that was really my first project that Dr. Chopak-Foss had me do. And again, she let me have that creative freedom of, what it could potentially look like. Here's what I would like on it, QR code, things like that. Can you make it happen? And so, it's been a great partnership so far. And again, just having that freedom to work independently and, have my ideas.
And just for those of you who may not remember this Thursday, September 29th was our hurricane of the fall. So we had to go virtual, and unfortunately it didn't happen in person, but it was important beginning to looking at another area of maternal and child health, which is incarceral injustices.
And on this slide, you can see our most recent newsletter. And there's a link available on the screen as a QR code. But really, the newsletter has information from everything from research-related webinars in the field of MCH, opportunities that students might not be aware of that I can include in that newsletter to really connect them with. There's job opportunities, internship opportunities. We try to make it a, one-stop shop for MCH in the college. And so, and we've linked that to our MCHIG Google site. And so you can actually, if you want to scan that QR code, that'll take you to the Google site that we've worked on. You'll see, how to join and our past newsletters. And, you can take a look and see, if this is something, if you're not already a part of the MCHIG, if this is something that you would be interested in. And that's all on the website.
And I'm just going to brag for a minute on Alisha. She has a Google spreadsheet with all observances, monthly observances that she keeps track of and updates regularly. So the month tries to coordinate with whatever's going on with respect to maternal and child health. But if you haven't seen the newsletter, it's really amazing, and I'm just so proud of the product, and that she continues to be able to put it out once a month with all the other things that we need to do. So if anybody wants to help, we're always happy to have more input and assistance. Alisha would appreciate that too. So some of our collaborative activities would really include our maternal and child health interest group participants. And so these are some that we had 2 research symposium poster sessions in 2023, and 2 or 3 are in preparation for spring 2024. The submission deadline, I think, is March 1st. And we've had 4 ETAF commentaries published in 2022 and 2023, 3 in process for spring 24. And then very proudly, we had our first peer-reviewed publication come out just a couple of weeks ago on adverse childhood experiences. We should have put the QR code for that, but we have the picture of it. So these are just some of our topics that we've addressed. Last fall, we looked at safeguarding mothers and children from PFAS exposure, looking at the new over-the-counter. For those of you who may not know, the FDA passed the oral contraceptive to be a specific oral contraceptive to be available over the counter. That should be available, I believe, coming up this spring at some point, and will be available in some of the major retailers. We did one on perinatal mood and anxiety disorders and addressing racial disparities in maternal health policy, and this was our publication. And this is our students from 2 of the posters that we did last spring.
Yep. And we additionally had several tabling events with the MCHIG group last year on the Georgia Southern Statesboro campus. These events typically involve creating handouts relating to a MCH topic of our choice, but we do try to align the monthly observations to our tabling events. And, encourage student engagement outside of the college, but with students from different degrees who may not have a lot of experience with maternal and child health issues. So here's some keys to success. Some challenges include, coordination between our schedules, which is pretty essential to our work and successful collaborative efforts, because ensuring that effective communication really helps align what we have coming up. And so sometimes scheduling can become an issue. So to kind of combat that, scheduling regular check-ins and meetings to discuss upcoming tasks and deadlines and any scheduling conflicts or adjustments that we may have to make sure we're meeting our deadlines. I try to align my schedule with Dr. Chopak-Foss as much as I can. So I'm here in Hendricks Monday through Thursday. And again, you really can't beat that face-to-face interaction with your mentor. And so it's something that I think is really addresses that, scheduling conflict.
And I need her to keep reminding me what her schedule is, because my memory is my memory in some cases with a lot of stuff on the plate. So we just work at really trying to communicate, and Alisha has been gracious enough, and we have shared our cell phones so that if there's an emergency, I can let her know that I won't be there, or if there's something that happens in her space, and it's just easier to do that. And so that takes trust, it takes comfort. It takes a certain amount of getting to know each other. And I think Alisha knows my work style and I know her work style. And really, as I said at the beginning, I believe mentorship is a reciprocal process, and I look at it as a journey. I have a year and a half left with her, and of course, other students who are here, but I'm already starting to think, oh my gosh, did I tell her everything I wanted to tell her? Have I showed her everything I wanted her to learn or think that might be useful for her? But it really does take two of us to make it a successful partnership. So some of our future directions, we have lots of ideas and lots of things and ideas that we want to implement. Certainly on her side, of course, is the continued growth and interest in the maternal and child health interest group in the college and across campus. Specific goals for improving maternal and child health outcomes, going after specific grants, mostly that will be related to workforce and or development of a MCH concentration down the road, and or certificate, and increasing our participation in state advocacy activities, because certainly advocacy is a very important part of what we do in public health. And you're going to do the last ones, right?
Oh, and of course, recognizing the importance of partnering with community agencies to extend our reach and impact, again, outside of campus, but really partnering with our community agencies and to share the expertise, for those working in the field of MCH. And again, connecting our members with experienced leaders in MCH and, having them have the opportunities to really apply the skills that they're learning, in the classroom to our campus, outside of our campus community. So here's a little advice for mentees. So I think it's really important to take the initiative to ask your mentor questions, let them know your educational and professional interests and objectives, and ask about their own experiences. I think this really can help the mentee-mentor relationship, because again, it makes it a lot easier to collaborate on projects when it's something that you're really passionate about, and when your interests align. Again, it makes it so much easier. And be willing to learn new things. Consider another perspective. Be responsive to suggestions and constructive criticism. Be really open to feedback and what your mentor has to say, because they're faculty in this college, and they really do know so much, and they're here to help you. And of course, stay in touch with your mentor and ask for help when you need it, and follow through on tasks and responsibilities. Again, that communication, whether it's email or Google Chat or face-to-face, is so important when trying to do the kind of projects that we've done this past year and a half. A lot of the research, a lot of the maternal child health interest group, not having that interaction, I probably wouldn't have been able to do so much that I've participated in the past year. And if you are interested in wanting to join the Maternal Child Health Interest Group listserv or newsletter, the QR code is on the screen. You're welcome to give it a scan and join our newsletter and have all the access to all the information that we're putting out monthly, information on our outreach activities, information on our research activities. If you have any questions, the maternal and child health email is on the screen as well. So you can always shoot us an email, and I'll probably be the one to respond, but you'll get a response from me, and we'd be happy to have you.
And we do meet monthly. This month, we're actually co-sponsoring next week's Grand Rounds with the Office of Practice and Research. So stay tuned for that, because that's going to be a really great presentation also. So thank you all so much for your rapt attention for the last 25 minutes, 30 minutes, and we'd love to have anybody who wants to ask questions.
So I'll start out with with a question, and this is to both of you. So for those that are looking closely at making sure that the mentor-mentee relationship is highly productive and fruitful, when you started making a decision of even agreeing to be a mentor or agreeing to be a mentee between the two of you all, what were some of the considerations that you had from both your perspective, from the mentee decision-making perspective and from the mentor decision-making perspective? And I'll let you all decide who goes first.
Do you want me to start?
Sure.
Well, first, I would say that Alisha having had 2 classes with me during her master's program, so she was familiar with me. We were familiar with one another. Certainly she was only gone a year, and we had kept in touch. I really tried to keep in touch with as many students as I can. And so I knew where she was. She was hired to be the health educator at University of North Georgia. And then her application, and then she emailed me about writing a letter of reference. And I can tell you from the faculty perspective, if a student asks me, I consider that an honor that they thought our relationship was such that I would be able to speak to why they would be a good fit, a good student in our program. So that was a no-brainer. That was easy. So once I knew she was applying, and then she asked about graduate assistantships, I did go back and reread her essay, and I thought, wow, this would be a really great fit. I had known, because she took the Foundations of Maternal and Child Health course, what some of her interests were, and I knew what she wrote her different papers on in the 2 courses, which were linked to some extent. And so I checked with my department chair, and I said, may I consider, how do we want to work this? And I got the green light. And so that started the process where I asked her, she asked about graduate internships. And I said, well, would you like to be my GA? And I said, here's the things that I'm working on. So now you can.
Yeah, absolutely. I think one of the things that helped as well, especially with keeping contact outside of, graduation, was inviting me to guest speak with the capstone class. And of course, having that shared interest, and, always being open to especially with the research ideas that I have, and again, even being underneath the realm of maternal child health and child health, very receptive to, kind of my interest in reproductive health and women's health in general. And so you've been very receptive to supporting the ideas that I have. So that's something that I think really helped establish our mentee mentorship relationship.
Okay, thank you. Other questions or comments?
Hi, Dr. Chopak.
Hi,
Um,
Bradley.
I just wanted to say this is so awesome that you guys are doing this. I wish that this would have been around when I was doing my BSPH there, but this is really awesome. And I am so grateful that I got to be your mentee back then too, working on that evaluation project. Really sparked my passion for maternal and child health. I'm now an evaluator for a federal Healthy Start grant. So yeah.
Wonderful. So proud of you. Great to see you.
Okay. We just had one comment from Dr. Sarkiver. Dr. Chopak is a great mentor. Okay. Anybody
I can
else?
that as well.
All right. So it doesn't look like we're getting too many other comments or whatever. It just seems that people are grateful for this, and we want to then close out with a thank you to everyone who attended. It's a nice group, and especially to our speakers. You know, the wisdom that you shared, and it's pretty clear that you all really good work together, and that you gained a lot of wisdom from each other in terms of that. And we are hoping to have that. So for everyone's benefit and knowing, we did record the session, and then we hope to get the PowerPoint slides from the two speakers. And then after that, they'll be posted on our website. So unless you have any closing comments, we'll leave it at that.
No, just thank you all for attending, and thanks for all of the warm comments. Really appreciate it.
Yeah.
Thank you so much.
Okay, all right. Well, thank you all very much, and we hope to have back. We have another seminar the same time this next week that we hope that you can attend, and we look forward to seeing everyone. So thank you again for attending, and we hope to see you next week at another very interesting seminar. All right, take care, everyone.